Patient Matt.
Yeah.
It appears as though you are between the profession called dying.
Yeah, I think I'm dying here, man.
Good. I think I concur. So I was just looking at your chart here. Looks like it's gonna be a lot of work if you're gonna live. So I was thinking charging you everything you'll ever own, along with your kids and grandkids.
Oh, man. How about just one of the grandkids?
No, I mean, there's a lot of grandkids. One really isn't gonna do it for me.
Man, I think I'm just gonna have to die then, because it's not worth it.
Alright, so that'll be our standard dying fee of 50,000. Hi, and welcome to Neckbeard Nation, a show where us neckbeards talk about neckbeard stuff in a neckbeard-like way from an atheist perspective. I am Buck, this is Matt, this is my God What a Pop, that is Matt's hat of the day, and today we're talking about the riveting subject of healthcare. Nothing excites a crowd like paying for being well. And so, as always, a small chronology on this one. We're going to start with the olden days. Doctors would often, come around to your village, see if anyone needed any medical care. They'd either barter for it, or if you were impoverished, you would just get some small treatment for free. But really, since there wasn't all that much the doctor could do, it was quite limited as to sort of the payments and services and whatnot.
Was that the time when they were also barbers? Wasn't like barbers and doctors?
Yes.
Yeah.
A lot of the early medical methods were bloodletting.
Yeah, that's what I was going to say. Your options were basically bloodletting or leeches, which is kind of the same thing.
Right. And since there, is the same kind of stuff you'd use for hair cutting, and that's what the stripes on the barber pole still represent today. The red for the blood, white for the cleanliness. So you go from that sort of era where medicine is somewhat barbarous, and the more advanced medicine becomes, the harder it is to find payment solutions for masses to get that health care. We go into the 20th century, and we have the beginnings of modern hospitals. And you have situations where you have kind of run down places, but you have tons and tons and tons of people who have to go to the hospital because of lack of preventive care, shorter lifespans, things like that. And you have sort of these charity missions. You get the Christian hospital, the Jewish hospital, stuff like that. It's not really often secularized.
Yeah, I noticed that. A lot of hospitals, even nowadays, are tied to a church or religion. It's weird.
Yeah,
or a saint.
Yeah, absolutely.
Yeah,
I mean, it is a relic of that era. And
they still want your money, though.
Yeah, no, they will get charged more by the church than the state for your services. I mean, unless you're, of course, poor, and then they may have, a separate deal for you. But at the public ones, it's not that hard to claim you're poor. I did that when I was in college. When I was in the hospital, I just told them, like, yeah, I don't have any money. You fill out a few forms, and they're like, okay, it's free.
Oh. That didn't really work for me when I was younger, but
Oh, well, being a lawyer, you have to know how to lie to the government. So I did that very nicely. Yeah. I have $0. I make $0. So yeah, if anyone's watching from law enforcement,
is the statute of limitations up on that one? You're probably
No one cares anyways. So, from that origins, you get more and more of a call for easier access to healthcare, for better payment options for healthcare.
It's probably the Industrial Revolution stuff, and the big cities probably played a big part in it. A lot more infrastructure, a lot more people living in a smaller, confined space.
Sure.
All going to develop.
Right, and the development of better, larger buildings, skyscrapers. I mean, hospitals aren't, way up tall skyscrapers, but certainly different building materials helped build nicer and more steady hospitals. And then, you have, after World War II, a socialized medicine in the UK. And that's where that sort of way of thinking of this begins. The idea that the government is going to pay for you to be healthy.
Is that common now in the modern world?
Yes.
Did that kind of catch on? Or?
Yeah, throughout Europe, Canada, you're sort of happy, healthy countries.
So they literally, government provides this. I've heard it described as it's like a basic human right, or what is it?
Absolutely, a basic human right. Yeah. And so far, our politicians here in the U.S. have not seen it that way.
It's a foreign concept.
Yeah. It's one of the many ways we're not European. And so, you have that, but that has the counter side of not giving people as much opportunity in a capitalist way to innovate and to come up with better treatments and to allow for, more in-depth patient care. And certainly, there's no better place to be sick than if you are wealthy in America. Yeah. Because you can buy some amazing health care.
I actually talked to one of my religious bosses about this. I told him how in Canada healthcare is provided, and he's like, I would never want that in this country. I'm like, why? It sounds weird to me. He's like, because you want to wait in line with all those dirty poor people, and like you're going to have to wait behind them, and you don't even know if you're going to get seen that day, and there's going to be all these disgusting people around you. It's like, what are you talking?
Well, there is some weight in it, but that whole dirty poor people thing is just terrible.
So he doesn't want to wait. He would rather those people get sick and die just so he can have the convenience of
paying.
It was sickening.
Yeah, that was really dumb. So you have people with that kind of attitude, and it's sort of our right-wing attitude in this country right now.
It's funny, the people with that attitude are the ones with the money. It's not the poor people.
And the Christians.
Yeah.
Because the Christians are the Republicans, and they're the ones who are calling for the poor to die.
Yeah.
So that's an interesting turn of events.
And not everybody can be rich. It's like, the poor people die off, then who's going to be your slaves?
But then there'll only be rich people, and we'll all be happy. Like, who's your butler? Happiness. No. So you go to that sort of thought of it when socialization begins. And there are, as time goes by, more medical treatments become available, long waits for procedures in these socialized medicine countries, and that continues still to this day. In Canada and the UK, you can, be sitting there for a heck of a long time and have a very long wait to see a provider there. But, it's free, and everyone is treated the same. Very egalitarian, some would say. And the other side, some would say communist. It depends how you think of such things. But, there's various economic models to each of those thoughts. Like, if we're paying for socialized medicine, that's a big strain on the economy. Yeah. And that was a lot of the talk against Obamacare and single-payer systems in this country.
But at the same time, it's a benefit because you have more healthy people able to work and work longer into their lifespan, you know. And,
absolutely. Yeah, so then there's that trade-off. Healthier population is, happier, wealthier, can more easily pay for it. And so there is that sort of thought that it pays for itself, or, it makes for a better society, even if it doesn't pay for itself.
Yeah. Well, and especially if you look at it as a basic human right, then there's no question.
Right.
Which, in a way, it should be. I mean,
Yeah, the right to not feel shitty.
The right to live and be, able to live. I don't know.
Yeah. Live normally.
Yeah.
And not be handicapped and things like that. But that does go against that other side we were talking about the innovation. And certainly, when it comes to innovation in medicine, the U.S. is far and away in front because of our domination in pharmaceuticals and in research. We can provide, to people who can afford it, some of the most amazing stuff there's out there.
But here's my question on that note: if we're at the point now where we're far more advanced, we're way ahead of everybody because of this capitalist system or whatever, however it's described.
Right.
If we're already at that point, we've already built this infrastructure. We already got the ball rolling. Couldn't our like universities and their research now take control of that, and we switch over to more, you know what I mean?
It could.
Socialist type?
I think that there is some economic barriers to that still. We are progressing towards more of a single-payer system. Certainly that's part of what Obamacare is doing in expanding Medicaid. But going forward from that, will it be more of an expansion of Medicaid, or will it be more of a system where people are going to have to enroll in some sort of national healthcare system, and they'll have to, from there, find a way to, get into the medical care, which already is poor in a lot of areas, and it has poor access. And that is another aspect of this, that people in poorer areas of the country are also receiving poor health care.
Yeah, I actually heard this like not news report, but it's like Vice or something on YouTube.
Sure.
They did a special. It was on like the ghetto basically, and how people are dying, getting shot and killed and everything. And they have all these. They have like three hospitals in this one area, and this kid got shot. And they couldn't bring him to the closest hospital because he couldn't afford it. So they had to drive him the farthest hospital away because he couldn't pay. So they had to take him to like the poor person hospital, and he died on the way there. Whereas if he could have went to the closer hospital, he might have made it.
Yeah, there is there's stuff like that. Something like that may have been because for high level treatments like that, you have to go to a level 1 trauma center.
Yeah. And
level 1 trauma centers are generally located in poorer areas because the wealthy hospitals don't want to take care of people like that. It's expensive, and it's not part of their business model. Yeah. And so the public hospital often is the one that takes gunshot wounds, things like that. And once you have that in place, then you're going to have to go take the poor people to the level 1 trauma center, which is on the other side of town. Yeah. In a way, it's not just simply, we can't pay for it here.
Yeah, I guess you're right.
It's more like...
And I don't know the exact details, you know what I mean? That could have been the case.
But it is part of the economic system where the poor areas are certainly the ones with this sort of level 1 trauma center, and people outside of there have to be taken in for the sorts of injuries that are often incurred in poor areas because of poor access to primary care and due to accidents like that.
I actually wanted to tell just a quick story. It's kind of funny. Right when Obamacare first came out, and I have a pretty close friend, and her mother is really sick with cancer. We went and visited her in the hospital, and they're religious Republicans, and the whole time her mother was just complaining about Obamacare. Yeah. And I kind of said to my friend, I'm like, why is she complaining? She's like, cause they tell her what she can, I don't know, what treatment she can get or what doctor she can see and blah blah. I'm like, but could she have paid for it on her own? And she's like, no. I'm like, so she's complaining about a service that she wouldn't have had otherwise.
Yeah, and it's not like she knows what treatments or doctors to go to. Yeah. It's like, yeah, they'll be provided to you because they're the right ones.
But, I didn't know all the details on that, but it was just the fact that, you would complain and you had nothing to begin with, and now you have a choice. Right. It's like, why would you complain? You know?
Absolutely. And, that's just a lot of the politics that goes with it. So this anti-socialist bent, a lot of our right-wingers have, of course, around the world right-wingers have that bent, but certainly it's a lot more prevalent here. You get to a point where, you have people who just don't really understand how it is that healthcare delivery works. And they get all caught up into, lack of freedom. And it was stupid shit like that. So, certainly for America, we have sort of a mixed system right now. If you're really poor, it's free. If you're really rich, you can pay an arm or a leg, and it's great. If you're somewhere in the middle, it's going to be a hardship. And certainly it's a hardship for anybody to be ill due to lost wages and things like that. But for the middle class, where they have to pay for the same treatments that, some of the wealthy are getting, and wasn't really meant for their price point, then they're getting into a situation where people are becoming indebted for being sick. And, some of the thought processes on that, people are saying, how moral is it to ask someone to pay for not being sick anymore? Yeah. And so, this idea that people owe their lives to their hospitals after their illness, just is a very broken system.
It's kind of on the subject, but it's a little bit off. But I always wondered, so if somebody incurs this debt with the hospital and they die, does that debt transfer to another family member? Or
sure.
How does that?
Sure. Well, the estate first would have charge of that bill, but if there's not enough in the estate, then that debt can be transferred further down the line.
To what, their children? Or
yeah.
Obviously, their spouse. But
spouse first, yeah. Then per piece, the children and whatnot.
Really? So they can go after the kids for the money?
Yeah. I mean, someone has to pay.
And that holds up legally? Or?
Sure.
It's so crazy, man.
Yeah. I mean, that's with, any sort of debt.
But the kids are a whole nother entity. They're not even... It's just weird.
Yes, they are. But, that's part of inheritance. It's not just the good stuff that you get physically. It's
so. Is there any way a kid could break away from that, beforehand, or can you stop this from happening if you wanted out of it?
No.
This is just crazy.
Yeah, but most often things like that are either paid by the estate or just written off as uncollectible. Yeah. Because the process does take a long time. But certainly you go to bankruptcy courts and you'll see most of the people on the list for that are trying to collect the debt are medical. And that is really too bad.
It's crazy, man. I don't think a lot of people realize that hospitals are a business like that, I think
hospitals are definitely a business.
It's crazy.
They are a huge business.
Yeah.
And here, they work just like any other corporation.
I always thought, like, growing up, I didn't think of it that way. I always thought it was, like, something that the government provided. Not that they provided, but it was an infrastructure, like, I don't know.
Well, there are some of those. I mean, there's the trauma centers they're talking about. A lot of those are government
Probably
owned.
VA, or definitely.
VA is government owned.
Federal.
And then, you have various church-owned entities that may be non-profits or charities or things like that. And then there are, for a lot of these for-profit hospitals. And you just can't get away from the fact that their first priority is to the shareholders and not to the patients. And by law, it is to the shareholders. And so you get to that conflict of interest between the Hippocratic Oath and the law that says you have to first think of your shareholders. So that is our show today on healthcare. It has been quite a lively discussion, I think. I'm going to shout out our buddy's belligerent atheist, guy in a wheelchair on my end. I think the street epistemology people.
Yeah, I'm working on a side thing. I'm starting to get ready to start doing street epistemology, and I've been meeting with some of the more famous YouTubers, Anthony Magnabosco and Socrates Jones. So shout out to you guys. Check them out. If you guys don't know what it's about, it's pretty cool stuff, and hopefully I'll be doing it in the future. Kind of getting ready for it. So.
Alright, shout out to all of you guys, all the Twitterers, all the YouTubers, all the Facebookers, all the internet users, all of the pandas, and whoever else is out there.
What's a panda?
It's a creature that lives in China.
Oh, you know a couple pandas?
They hang around.
Oh, okay.
Anyways, adios.
See you guys.